Hello everyone. Today the topic I am going to cover on my profile is a little different from my niche. It is about concealing and camouflaging the things which are not much treatable or are bound to relapse on a patient's face. These are kind of a pigmented spots. These can be birthmarks, that can be melasma, it can be a perioral pigmentation or untreated dark circles. So today we have a makeup artist Tanu with us. She is going to show you how to conceal such dark spots so that you don't have a kind of a socially embarrassing condition, people asking you why you have dark spots on your face. While you are getting treatments also done in our clinic, you can conceal these spots. And some of the pigmented spots which are on your face are treatable to some extent, and certain residual pigmentation can remain. So you have to just use a correct concealer and corrector. This she is going to teach us how to do it. So Tanu, over to you.
Sure. So, can we have a look at our subject today? So, she has good skin, okay? But the only problem on her face today is that she has uneven skin tone, and especially towards her mouth area, okay? And below the chin, if you see, it's actually a very dark black spot.
So we are going to match this with the rest of our face.
So for any kind of blackness or black spots on the face, you can use an orange color corrector. Okay, so it has to be right onto the top of your blackness, and you can then cover it with the foundation or any concealer which is of skin color. So I'm going to show you how you can conceal the black spots. So I'm using this orange color corrector, okay, taking it on a Q-tip, like really less product, and placing it onto the top of her blackness, just like so. You can also use a beauty blender, or you can also blend it with the help of your fingers. So I'm just blending it out. So you can see it has cancelled all the blackness which was there underneath. Okay, so it has made it orange. Now what we can do is, the next step is, we're gonna let it dry for a minute, and then we can go in with a foundation or any skin color corrector or concealer that you have. And if in case you have any active acne or redness on your cheek area or wherever on your face, you can also cancel it out with a green color corrector. So I'm using this LA Girl green color corrector with the help of a Q-tip again. I'm using a very small quantity and just placing it on the top of her acne. This is an active acne, and I'm just cancelling the redness out with a green color corrector.
So you mean to say for the dark patches we have to use orange corrector, and
Yes.
for the redness and pimples, if we want to attend some function or party and we want a immediate concealing effect,
Correct.
we should use a green corrector,
Green color
and
corrector.
over the top we should apply a concealer or a foundation.
Or a foundation, yes. Now I've just taken a drop of foundation, and what I'm going to do is, I'm going to top some foundation right on top of the corrector that we have used. Very gently. To match it with her skin tone. So you can see that there is no darkness really visible. You can use the foundation in more quantity if the darkness is more, alright? And similarly, you can also dab a little foundation right here. So I'm just using a tint of foundation right on top of the green color corrector, like so. And do not overblend, because you want some coverage over there. That's the reason we've put all the correctors. So you don't want it to get mixed with the foundation. So more often what happens is, sometimes the product जो आपने पहले लगाया है, that gets mixed with the foundation and a third color is formed. We don't want that. We want to give it a break, let it dry, and then we top it with the foundation. Okay, and then you just gently blend it out over the edges.
This is the way the darkness has already disappeared from her face, and the pimple is also not visible. So this can also be done by means too. Some of the male patients which I get in my clinic are asking about how to conceal these things. So this is the way you can go and watch this video, and you can, for any tips, consult Tanu.
Thank you. Okay, so we have learned that how can you use concealers and correctors to look more presentable even if you want to step out with some kind of pigmentation which is already there on your face, which is not treatable like ma'am have said. So yeah ma'am, so what kind of patients do you think that you visit and they're so conscious about looking so?
Yes, certain patients who have got a chronic melasma, which is a bigger lifestyle disorder, and some of the male patients also are coming to us with melasma or dark patches on their face. They also want to learn how to conceal this thing, to attend some party, to attend some function, and this is completely natural. It is not visible on your face that you have applied certain makeup or that. So you can see over here how this dark spots has diminished and the pimple is also not visible. So this is the concealing effect, good quality makeup product, good quality concealers, and while you are taking treatment you can consult the doctor, and if they allow you to use these concealers along with the treatment you can use it. And for those things like freckles, they always remain a little bit, or a chronic melasma or a pigmented spot or PIH, you can conceal it that way.